Hello everyone, this is Teresa, physical therapist here in Atlanta, Georgia. It's not often that I come on and talk about success stories. It's more informative, how I can help you, but I thought I would take the opportunity, since there is a lot of spare time now, to discuss some successes over the next few days. One in particular that I would like to talk about today is a case in Florida. She actually was, she was a Cigna patient who moved to Florida from New York, in a little small rural town that didn't have a lot of access to a lot of different options, but thankfully I was there. And she came to me with a variety of issues, but first we started with her shoulders that were chronically frozen, with very limited movement, and she had a significant amount of pain and discomfort when she tried to do things with them. She had been told by previous doctors that there's literally nothing that could be done about her shoulders other than doing surgery and doing joint replacements on them. Not just one, but both shoulders, by the way. One just happened to be worse than the other. So this particular person, she had a history of diabetes, and as some of you may know, it is a sequel of events that typically happens with diabetics, is that the joints become tighter, especially the shoulders, and they can scar down really easily. But the great thing about it is conservative care like physical therapy can really turn things around. So this young lady, I worked with her over the course of several months with a variety of issues, starting with the shoulders, as I mentioned earlier. We did a lot of manual things. I don't know if you all remember me discussing previously, is that manual things is where I use my hands, and that involves soft tissue work around the shoulder girdle, a lot of joint mobilizations where you actually glide and move the bones on each other, towards each other, away from each other, to achieve the ultimate outcome, in this case, which was range of motion reduction and pain reduction. And before that was combined with a variety of things, including iontophoresis, which is the use of medication delivery through electrical methods. And we use corticosteroids that also help with reducing the inflammation, and combined with exercise, progressively strengthening the shoulders, we were able to fully restore range of motion of both joints, and to get her doing all of her normal activities again. And the great thing about it, it's probably been since 2017, it's 2020, that I saw her last, and we still correspond via Messenger on Facebook. Great way to stay in touch and keep me abreast. And she and I were corresponding maybe 2 weeks ago, if that. And she said to me, I'm just amazed at how well the outcomes were, and still are. She said, my shoulders are still in great condition. I can still do whatever I want to do. I don't have pain. I don't have limitations. And she said, I am so grateful that you were available and that I didn't go through having surgery, because you really helped me and you changed my life. And to me, that is a piece of what makes me get up every single day and makes me thrilled and super excited that God gave me the gift of my hands and the ability to become a physical therapist and to provide unique services to help people overcome problems. Unless you've been in a situation where you've lost something that you were accustomed to using, or you never develop something that people your age normally develop, you may not quite understand it. Or if you never really had pain that was so bad it limited what you could do every day, like simple things like reaching into a cabinet to get a coffee cup, or pulling your shoes on, or pulling your pants on and bending over to pick up something from the floor. But I tell you, simple things can really make a huge difference as long as you have the right set of things put into place for the problem at hand, and that you're consistent and you follow the instructions of those who have advised you in the most appropriate way. Now, I will say this, as you notice with the scenario that I gave you, she had been given some bad advice. First of all, they said to her there was nothing else that could have been done. I think she may have had a couple sessions of PT early out in New York, not very much, but pretty much everybody had given up on any type of conservative option for her shoulders. And, you know, I just think, first of all, she was misled. She was ill-guided in that recommendation. And I always recommend, if you're going through a healthcare provider, whether it be a physician, a physical therapist, a speech therapist, or any other provider for that matter, and they give you information that it just doesn't quite sit right with you. You don't know if it's right or if it's wrong, but you don't feel comfortable with it. Always seek another opinion. And if that one doesn't work, seek another one. Sometimes you have to find the right match for your needs. Not every doctor or every physical therapist have the same set of skills. Yes, we go to school, we get trained in entry level and advanced degrees. We have to satisfy the curriculums and the requirements to move beyond that. But after that, you know, we enhance our skills and our expertise in particular areas of interest, and we become stronger in areas of interest that we have worked hard to develop those skills. So one provider, say for instance me, if you come to me to do something with pelvic floor or incontinence, that's not my greatest strength. Yes, I know how to give you some basic information and how to manage that, but that is not my strong gift. So I myself would prefer and recommend you to a physical therapist that is trained in pelvic floor exercises. And there is nothing wrong with acknowledging the fact that every gift that's out here doesn't lie in my hands. But I do, and am very grateful that I do have colleagues who have other gifts that I can ultimately help and assist with that referral process. So when you have questions, ask questions. And if you're in the hands of good people, they will help you understand whether or not they are the person to be able to assist you with the issue, or if someone else should be on your team and providing assistance with overcoming that problem. So don't be afraid to ask questions. And if you're going through something and it feels like it's not right, it's not working, don't be afraid to get a second opinion. But also give conservative care a chance before opting into more invasive surgeries, because oftentimes, especially with things like back surgeries, joint replacements in particular, the shoulders, the results long term, honestly, they are just not the greatest. I mean, you may get some really good short-term results after the pain and the immediate surgical portion of it has settled down, but typically, because that's not a normal part that hasn't been invaded by surgical tools and everything else, it's just never the same again. Now, there are certain parts of the body, if you do conservative things on it, sometimes surgery is definitely warranted. I myself have had an anterior cruciate ligament surgery done on my right knee, and I can do exactly whatever I want to do with just maybe even a just slight limitation. But if you saw me, you wouldn't even know it. I can squat, I can kneel, I can run, I can jump, I can do whatever I choose to do. So you also have to know, if you're deciding on something surgical, whether or not the risk are, and the benefits, if that ratio falls in line with what you feel comfortable with making that decision. But just wanted to put a little plug in, talk about the success. So I'm super excited about, I can't call her name right now, but she is a dear friend of mine, love her to death, her progress. And I'm so hopeful that she will continue to have more success, as well as all of the patients that I encounter. So take care. Happy Friday.